The American public has largely memory holed Donald Trump's disastrous handling of the COVID-19 pandemic. But as we prepare to enter a second Trump administration, there are parts of that response that are worth re-examining, like Trump's approach to COVID testing.
When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please. They test and they test. We got tests that people don't know what's going on. We got tests. We got another one over here. The young man's 10 years old. He's got the sniffles. He'll recover in about 15 minutes. That's a case. Add up to it. That's a case.
Slow down the testing, please. Trump was angry that the country was testing so many people because that meant we were finding more positive cases. And in his mind, more positive cases made Trump look bad, almost like he was mishandling the biggest health crisis in a generation. So Trump's instinct was to cook the books, to mess with the numbers, so America looked like it had fewer cases than it did. Never mind that fudging the numbers would get in the way of solving the actual crisis. This was about making Trump look good, or at least less worse. And now that he is returning to office, we can expect even more attempts to mess with critical data collection efforts. The Trump World Project 2025 agenda makes several recommendations as to how the incoming administration can screw around with data. Things like preventing the Equal Employment Opportunity Commission, the EEOC, from collecting basic data on race and ethnicity, and preventing the Centers for Disease Control and Prevention from collecting data on gender identity. The plan also includes manipulating U.S. Census data by adding a citizenship question and gutting America's weather monitoring infrastructure, including the National Oceanic and Atmospheric Administration and the National Weather Service, to erase data about climate problems that conservatives don't want to admit exist. Now, this week, we got our first look at what this conservative war on information actually looks like in the real world. If you followed this last election closely, you may remember how ProPublica reported on the deaths of two women, Amber Thurman and Candy Miller, both of whom died because they could not get access to safe and legal abortion care in the state of Georgia. That reporting was based on information ProPublica received from Georgia's Maternal Mortality Review Committee, which determined that both women's deaths could have been prevented. Republican officials in Georgia, confronted with the deadly reality of their abortion ban, were outraged that ProPublica was able to obtain that information. And now ProPublica is reporting that the state of Georgia has dismissed all 32 members of that Maternal Mortality Review Committee as punishment for leaking data about those two women's deaths. It is a stunning act of retribution, but it is also an attack on the public's right to life-saving information. Joining me now is Amy Urkanen, the ProPublica reporter who broke the story about the dismissal of Georgia's Maternal Mortality Review Committee. Amy, thank you for being here tonight. First of all, who is on this commission and what happens now that all 32 members have been dismissed?
Thank you so much for having me. This commission is made up of a wide range of professionals. There are doctors on this committee. There are nurses on this committee. There are doulas, community members, substance use specialists. A whole range of people serve on this committee. And their job is to review these maternal deaths and to sort of look at them from a bigger picture frame of reference and to try to make suggestions, make recommendations to reduce the number of deaths. Now that they have all been dismissed, there is no one in Georgia to review those deaths right now. I understand that the Department of Public Health is trying to refill those positions so that they can resume this extremely important work. We know Georgia is struggling with a really high maternal mortality rate, disproportionately affects Black women. Right now there is no Maternal Mortality Review Committee, and they are in the process of rehiring and refilling those positions and taking applications as we speak.
I would imagine it was shocking to the members of the commission, but what about the groups around the commission that are advocates for maternal health and working to solve the questions of maternal mortality? Is there any sort of are there any consequences, I guess, for Georgia deciding to do this?
Well, I know that a lot of people have gotten in touch with me to talk about sort of their shock at this move by the state to remove the committee. I think there is outrage that this step was taken. And so I'm not sure what the next steps are for them. Again, the Department of Public Health has said that they are going to try to refill it, get it back up and going. And in the letter that they sent to members, said that there would be no delay in the work that they do. Obviously, a lot of experts have a lot of questions about that. It's hard to imagine they can dismiss an entire board and there would be no delay in the kind of work that they do. So there's certainly questions about how much this could delay the very important work that this committee does.
I mean, there are committees like this across the country, and I wondered the degree to which you think that this is a model for red states that have abortion bans that are looking to suppress information about the human cost of those abortion bans. I mean, are these commissions going to become more politicized or the focus of political anger from the anti-abortion movement as we go forward? How chilling do you think this the effect of this is?
Again, that's a kind of an open question, but I mean, a very huge concern for sure. The chilling effect could definitely be there. And Georgia isn't the only state where we've seen some changes to maternal mortality review committees kind of in response to criticism or in response to politics. Idaho allowed theirs to basically lapse after a special interest group took issue with some of their recommendations. In Texas, you saw a little bit of movement. You saw a member who had been on the board who made a public criticism. Suddenly, her seat was sort of shifted around and she reapplied for it and she wasn't able to get it. So, you know, there have been changes. This is the first time we've seen an entire board dismissed. The reasons that the Department of Public Health said was for violations of a confidentiality agreement.
Yeah.
But yeah, there's certainly concerns.
Well, it is an really important reporting. Amy Yurkanin with ProPublica, thank you so much for your time tonight. Really appreciate it.